son, John, who is 13 years old. He and his dad were fixing mooring whips on the boat because there was a storm coming in, and he had to open a socket set that had zip ties on it. And he grabbed the first thing they saw, and he got a fillet knife, and he sliced right through his finger. They went to the ER that night. The ER doctor immediately saw that the tip of the finger wasn't bending. So I went to a orthopedic that's local to me. We're down by the shore, and he immediately, he saw the finger and immediately called Dr. Baka from his office and said, "You need her." And he said, "And I think you're in luck because I think she's just back from maternity leave."
When we went and took a look at him, he actually got both of his tendon and his nerve. Cuts in this area can be problematic because of where it is in the finger. It can lead to adhesions or scar tissue formation, which limits the use of the finger even after repair. Without a surgical repair, neither of these two structures would regain function, so it was pretty obvious that he needed surgery when he came to see me. The surgery itself involves repairing both the tendon and the nerve, but then afterwards it involves really intensive therapy to regain that function back and to prevent scar tissue from forming.
She walked us through everything she was going to do. She came to the bedside when he was getting ready to go into surgery, explained what she was doing to him as she was marking his hand, what she was doing, why she was doing the things, and she walked right into the OR with him. Like when I had to leave, she was still right with him. So at least he had a face that he didn't know, even though, all of the staff at the hospital was wonderful. But I was very thankful that he had a face that he knew, that he had met before, and that he trusted to walk in with, because he was scared too.
As soon as he was ready, which is about 4 weeks after the surgery, we got him into Children's Specialized, began working on this program for tendon excursions, a partnership to have here with Children's Specialized, because I'm right available in the building if anything is happening with my patients, and I can help direct the care and manage any problems that arise as they come up.
The day that he came out of the cast, we had coordinated that he would have the cast cut off, came over to OT for therapy. We had to construct him, we had to clean out his wounds, get all the stuff off from surgery, and then we constructed him with a dorsal splint that would keep his tendons in a safe position, because those tendons have been newly sewn together. And if you move them too much, there's a chance that the sutures could rip apart, and then the tendon could lose function and have to start over again. So there's a very specific protocol that has to be followed for 8 to 12 weeks after surgery until the tendons have enough strength to start moving again. So initially we saw him twice a week. We would clean the wound, work on some active motion in a safe way, teach him how to start using his hand again, because even the fingers that weren't injured had been in a cast for so long that they were stiff as well. We continued to see John twice a week for occupational therapy, doing scar massage, and then slowly progressing his exercises to get the tendons to glide, to separate out the index finger bending here and here. He had some complications with the scar tissue that we worked through, and we've slowly each week been able to add on more exercises.
They've been great. And John immediately connected with Janelle because she knows fishing. He is working hard every single time that he comes. And there's absolutely been improvements with the movement in his finger and him being able to do things, and now being able to go back to his playing sports and fishing and gym class and the little things that he's missed since August when it happened. So.